Occupational therapists. It's an interesting topic, right? Especially considering the way that they are positioned in the aged care system to really be the gateway to accessing certain products and even types of services to remain independent and well in the home. So I often get questions around, are they really worth it? And what can they tell me that I don't already know? After all, I'm walking the shoes of my own body. I know the challenges that I face every day. Why do I need somebody else to tell me what they are? Or at least validate what they are? It's a good question, which is why I decided to catch up with an occupational therapist, an expert in their field who can shed some light on these questions and to also show the village local community, if you are coming across an OT, how to make sure you get the most value from the opportunity. So let's jump into it. So where does the necessity for an OT come into play? If I felt that an OT assessment would serve as worthwhile, I would find one. But remember, we know what we need.
I guess none of us want to think of ourselves as aging, but the reality is falls in the community are a huge risk to people. If someone falls and breaks their hip, the risk of them going into care is extremely high. They've done studies and it's shown that someone who has a broken hip will go into a nursing home within 2 years if they don't get the right healthcare. The percentage of that's something like 85%. So it's really important to try and prevent falls. And the best way of doing that is to have this holistic assessment of someone who can come in who is objective, can make recommendations. They should be able to work with you to address your needs and your wants, but they also should have hard conversations with you around how you can reduce your risk of falls, how you can stay independent, even how you can improve your well-being. So for example, I saw a lady on Monday who was referred to me because her son wanted a lightweight wheelchair so we could take her out to the shops. So it sounds like a pretty straightforward referral. He was of the same view. Why do I need to see an OT? I can go to the chemist and buy it. After completing my assessment, there were over 10 recommendations to the home care package for this lady, which included a pressure mattress and a pressure cushion. Now, the client didn't know she had a pressure injury or a bed sore, as people often refer to them, as she wasn't able to check it. Her son, who goes in to take her out once a week for a shop, wasn't going to ask, can I see your bottom? The support worker who goes in to clean the house wasn't going to ask her. But because I did a skin check as part of the OT assessment, I was able to identify this as a really serious health risk for this lady. We're able to maximize what people can get out of packages because we know aids, we know different types of services, we know different ways of doing things. So by using the OT, you can really maximize your independence, maximize your safety, and maintain your well-being.
So if we take a step back then, that was a really good sort of holistic image of the value proposition that an OT can present to somebody who's on a home care package, or maybe not even on a home care package, just receiving aged care services. Maybe can you spend a few minutes really boiling down what does an OT do and how do they apply their clinical expertise?
Sure. So an OT is a health professional who's trained to look at someone's needs in regards to how they complete their daily activities. So these will be things like getting in and out of bed, showering, putting your clothes on, cooking, cleaning, even getting out to, if you're still a member of a club. So we'll look at the holistic thing. We do this by looking at the person, their medical history, their social supports. We look at the tasks, but we also look at the environment. So in the aged care setting, the OT would go in to have a look at someone's house and assess risks, assess safety, and try and promote their well-being to try and keep them at home. So similar to how a physio would look at your muscle strength, an OT also looks at your muscle strength. We're not going to get out some sort of fancy muscle measuring device to check how strong your legs are or even how high you can lift your legs, but we'll look at the practicalities of it. So you have a sore knee that is impacting your ability to move around. How are you actually going to get on and off the toilet? How are you going to get into and out of bed? So the OT will ask you to do those type of things because by watching that, we can see what you're doing at the moment and we can start to formulate in our head, okay, maybe some aids are needed. Maybe home modifications are needed. Maybe you would benefit from having a support worker in the house while you're having a shower, not necessarily giving hands-on assistance, but just someone there to increase your confidence and also as a bit of a falls risk prevention strategy.
To me, if I was experiencing day-to-day challenges, my headspace would be, why do I need somebody else to tell me what I already know? Why is it that an OT is well positioned to add value to that scenario?
Sure. So I guess as an OT, because of our training at university and then also our clinical background, we're able to look at what the person is telling us, but also what we know about physical difficulties, and we can apply it in the everyday world. So we can use our clinical experience and our knowledge to know how we can best support people at home. We know that you might know that you can get into and out of bed. This is one that I get all the time. Someone says, I know how to get in and out of bed. I just hold on to the side of the mattress here. But then I go in and say, yeah, but you can also get an aid that will slip under your bed, a bed rail, that gives you that extra bit of support. People always say, no, I'm managing at the moment, it's fine. I really encourage them to have a go of the bed rail. And it's often the piece of equipment they go, I do not know how I live without this for so long. It has made my life so much easier. So I think it's that real, you don't know what you don't know.
What does that clinical assessment process look like?
So in the referral, we'll have information about their medical and social background. The OT assessment is best completed in someone's home, whether that be, a family home or an aged care facility. The assessment would take normally between 1 to 1.5 hours, during which the OT will ask the client and family or support workers a range of questions on their medical background, their social supports, and how they're coping with everyday things, as well as what they're finding more difficult. So OTs really want to know the details. So I don't want to know if you can just shower on your own. I want to know how often you're showering. I want to know if you're sitting up or standing down to shower. Do you wash your body, but you need to go to the hairdressers once a week because you can't get your hands up to wash your hair? So we're really interested in the details. The assessment also has a physical aspect. So this would look different to a doctor or physio assessment. The OT will ask the client to show them what they're doing. So we will say, come on, let's go have a look at the house. Can you show me how you get on and off the toilet? Can you show me how you get into and out of bed? Can you show me how you get into and out of your car? This shows the OT what the person is currently doing, but it also helps to start formulating some of the recommendations by seeing what the client's strengths are, but also areas that they'd benefit from support. Like I mentioned, the OT would have a look around the house. We're not there to have a look, have you made your bed or have you done the dusting? We won't judge the cleanliness of the house. What we're looking for is the layout and any falls risks. So loose mats, especially in the senior population, is a big one. The final step of the assessment is normally the recommendations. So a good OT will sit down with their client and explain what the recommendations are. Now, the client can choose to act on these recommendations immediately, or sometimes they like to mull them over. I always recommend to my clients that I include all my recommendations in the report back to the home care package. By the OT including all the recommendations in the initial report, that means if things change in 3 months, 6 months, 9 months, and the client decides that, yes, they do want to proceed with those recommendations, another assessment isn't needed. So we're preventing double dipping into the package for another assessment. The client and the home care package can go ahead and order whatever the recommendation or the aid is that the OT initially said.
Many people in our Village Local Community Hub have often raised the concern that their home care provider is pushing back on the purchase of a particular item. Mm-hmm. Let's say this item was a mobility aid and it costs $200. And the home care provider is saying, we may recognize that you need this mobility aid, but in order for you to use your government home care package funding, you first need to get a report done by an OT, a qualified professional, to validate and verify that you need this. And where that really causes concern for many of our in our community is that OT report might cost more, often does cost more than that $200 item. So it's you're kind of left scratching your head. I can understand why the government would mandate it. You want to make sure that taxpayer dollars are used for the things that are required. Your point that you made right then, where you said verbatim, a good OT will come into your home and do an assessment and look holistically to think about what you need potentially now, why you called out specifically for the one item, but because they're looking holistically, they'll see other things that may be relevant for you now, in a few months' time, and make these alternative suggestions or more holistic suggestions, which you may want to act on now and in the future And because that report was all-encompassing, it saves you money in the long run.
Yes. And I think it's
Right.
about maximising the benefits that you can get out of your package. So an OT coming in and thinking laterally, asking the questions that other people may not have asked. Although the client hasn't identified that as an area that they want to work on, I think sometimes it's also about identifying it and sometimes just planting the seed. So saying, I'm going to see a lady tomorrow who I saw about 9 months ago, who she wanted a riser recliner chair. She was adamant that's all she wanted. She was also having difficulty getting into and out of bed. In the short term, I recommended a bed rail. I said to her, oh, I think in the very near future, you are going to approach needing a hospital bed because lifting her legs into and out of bed was difficult, as well as positioning in bed. She was adamant, no, I don't want it. Please do not include that in my report. After I discussed with her, I think would be really beneficial because if you do change your mind, we're then not having to go through this whole rigmarole of the assessment again. We can just proceed with the trial. She agreed. I'm now going to see her tomorrow to trial the bed because she has realised that it was becoming more difficult. Luckily, she has surplus of funds in her package. So rather than waiting until she had a fall out of bed or got stuck in bed, she's going to be proactive. So we're going to trial a bed and try to see if we can increase her independence and her comfort in her own home.
That's amazing. And that's really interesting that you're saying you're going to trial a bed. Tell me a little bit more about that process, because in a previous conversation that you and I are having, you also mentioned a similar type of service offering where you were helping somebody else trial a mobility scooter and getting involved in what that process looks like as well.
Sure. So the trials of the equipment, I think, are really important when it's either a high cost item or deemed as an item of high risk. Now, reasons I say high risk for a mobility scooter is it's risk to the client getting onto and off the scooter and driving it, but it's also a risk to the general public if someone's out in a busy area. So the OT would want to trial this item of equipment because it's going to be high cost. It's going to take a big chunk out of their package, especially for someone who's on a level 1 or 2. Also, we want to check the risk that the client can safely manage it. Now, with a bed, it would be a similar issue. It's high cost. For an electric bed, we're looking at anywhere between $2,500 to up to $10,000 if the person is also requiring a specialist pressure care mattress. This lady that I spoke about previously, she doesn't require a specialist pressure mattress, but I'm wanting to trial the bed and the mattress with her because comfort. Who would want to buy a bed that they haven't had a go of? No one. So we're going to trial out the bed to check that she can use the remote control correctly, that she can use the functions of the bed to suit her, but also that she's comfortable on the mattress and it's going to meet her needs.
Got it. Makes a lot of sense. So Louise, a question that often comes up as well is people just aren't sure what they can use their home care package funding for. What are your thoughts on that?
I definitely think it's difficult for clients to know what they can use the home care package for. The OT will know because we've got experience in seeing a wide range of clients. The best way to explain it to people is if it is an item that is required because of your medical background or disability. So, for example, I saw someone this week who asked me if they could get a new dishwasher through their home care package, which the home care package, the government has mandated, the Commonwealth, that they will not fund a dishwasher. The reason for this is it is not a specialist disability or medical need. Most people, would benefit from a dishwasher. Whereas something like a walker or an electric hospital bed or a shower chair, most people do not require these in their everyday life. The person who is needing these items need them because of their disability or medical background. So that's the way that I always try to explain it to people. There is a little bit of a grey area with technology, such as iPhones, iPads, etc. I always encourage you to either speak to the home care package provider or if you're linked in with an OT, ask the OT the question. I always say to my clients, the worst they can say is no. We can at least try for those items of grey area.
I hope those listening into this are finding value in this conversation because we've got a lot of nuggets of gold here that not only you see the value of an OT and how they can impact acutely what you're needing, but also add additional value because we also know that those receiving government-funded services or government funding in general through a home care package, a big portion of people's funding actually often goes unspent. And that's because people don't know how to make use of that funding in a valuable way that is also compliant to what the government allows. Having somebody like Louise and her,
colleagues across the country in the OT field can provide that holistic vision of how to make the day-to-day easier in general. Hey, Louise, this has been awesome. Big thank you for the time and effort you've put into it. How can those get in contact with you if they've got additional questions or want to reach out?
Sure. So I'm Louise from Plan to Stay Occupational Therapy. I am based in Sydney. For anyone watching in who needs an OT in Sydney, please get in contact. If you don't live in Sydney, you can either get in contact with me, or there's also the OT Australia website that has a list of all different providers and services around the country, and they would be able to point you in the right direction. I think also having a chat to your home care package provider, asking them, do they have an OT that they contract to, and if they can get in contact. One thing to keep in mind is, unfortunately, many OT services have very long wait lists. So I think trying to be proactive and getting on the wait list sooner rather than later. Even if the appointment comes up and you're not ready for it, you could always say, look, can you give me a call back in another 3 or 6 months' time? But I think making the referral to the service is really important, so it's delivered in a timely manner.
Perfect. Well, like I said, Louise, thanks again, and looking forward to chatting soon.
Thanks, Jim.